I'm Dr. Chuck Pierce. I'm an orthopedic surgeon. I specialize in arthroscopic problems of the shoulder and knee at UAMS. If a patient has shoulder pain, an adult patient, and there has been no injury, and they've tried medications like Advil and Motrin and iced their shoulder and avoided activities that have caused their shoulder pain, and they've done that for 2 or 3 weeks, I'd say at that point you have to start wondering if it's something else. That's when I would go to the doctor. I don't think you necessarily have to start with an orthopedic surgeon necessarily. If you know and like your family doctor, go to that person and let them start evaluating it. Most of the time it's not going to be a serious injury, but I think if you've done the basic treatment options like we talked about, I think it's something to start worrying about. The types of injuries that I see a lot are in my age group, the baby boomer generation, and for instance, a tennis player who plays 2 or 3 times a week and then has a tennis tournament on the weekend can oftentimes end up with a sore shoulder on the side that they use the racket with. As long as that sore shoulder responds to usual things like ice and rest and anti-inflammatories, that's fine. On the other hand, if that same player actually plays that tournament, slips and falls, injures that shoulder, has severe pain, and those types of things I just talked about don't help that patient, then I think that's something that ought to be evaluated and treated. A lot of times that can be a rotator cuff injury or even other types of things, possibly even a fracture. My goals for my patients are to get back to pain-free, full activity, if possible. Now, it's not always possible, but if the patient understands the parameters before the surgery, the pluses and minuses of the surgery, they'll usually be happy with the final outcome.